Number 9, mHealth in cancer care. Greater use of smart devices and wearable technologies is proving to be an important way to provide immediate access to healthcare data, patient education, care coordination, and follow-up for patients with cancer and those providing their care. mHealth, defined by the World Health Organization as the medical and public health practices supported by mobile devices such as mobile phones, patient monitoring devices, personal digital assistants, and other wireless devices, is greatly increasing in popularity. The growing ability to collect and transmit patient-generated health data is creating an opportunity to significantly improve how patients with cancer and their providers manage survivors' health in the months and years following cancer treatment. The emerging field of novel cancer care apps may also offer new, relatively inexpensive routes to supportive cancer care that can improve patient quality of life, patient education, navigation through complex medical systems, and personalized social support. The Food and Drug Administration estimates that 500 million people globally are already using personal healthcare apps, and that number is expected to grow to over 1 billion by 2018.
You know, those of us who grew up watching Captain Kirk on TV with his tricorder, thinking that this was just the most unbelievable science fiction, now have children who can't imagine a world when they didn't carry around their mobile device. And yet, now we have yet to see it truly applied to medicine. So our expert to discuss this today is Dr. Ann Partridge, who's the Director of Adult Survivorship and a member of the Breast Medical Oncology Program at the Dana-Farber Cancer Institute. And so Ann, we'd like to know, can you describe how mobile health technology is going to transfer cancer care?
Thank you, Monica. It's a pleasure to be here to discuss with all of you this disruptor, which I would argue is already disrupting cancer care and medical care in general. We already have Dr. Google, and everybody's carrying their smartphone around and learning on a regular basis about their own health and about if they have cancer, things about their cancer. But to date, much of this has been very stagnant, very one-way and not interactive. Now there are apps and there are programs and platforms that are just emerging to help people to manage their care and be able to use the web-based technologies and the apps to do something more iterative, either with their providers, and there is some work going on showing some value in that, as well as to manage themselves, which of course is what is the important aspect of survivorship care for the vast majority of patients with cancer who will live through and beyond their cancer. And then finally, I think where we're heading and what will be particularly disruptive is when we can kind of tear down the silos, and this is already emerging, where patients will be carrying their own medical records around on their iPhones, and we have this to some degree, and it will interact with the clinical systems, it will interact with the payers, and we will use it not only to measure and monitor and have iterative effects with that patients, but we'll also use it to learn. And this rapid learning system, both active and passive learning, as in measure what the patient is doing through their iPhone, not only asking them how they're feeling, I think has extremely great promise for research in the future to measure outcomes for patients.